Welcome, colleagues. I'm Jo Wilmshurst. I work as a child neurologist at the Red Cross War Memorial Children's Hospital in Cape Town, which is the largest children's hospital in sub-Saharan Africa. 60% of my service load is related to the care of children with seizures or the epilepsies. I'm also chair of the African Commission of the International League Against Epilepsy. So, Africa carries the greatest burden of disease from epilepsy compared to other regions of the world. In the majority of cases, this is due to preventable causes such as birth insults, trauma, and neuroinfections. The continent has the lowest ratios of child and adult neurologists in the world, and the need for more training and task shifting are critical to capacitate an adequately skilled workforce. Facilities are scarce and under-resourced, and access to medications is often unsustainable and interrupted. Overriding all of these issues are the barriers evident from stigma, which negatively affects those living with epilepsy and their families and undermines wellness. With the approval by the WHO of the IGAP, the International League Against Epilepsy has developed various tools to facilitate optimal outcome by 2031. The Epilepsy Journey with the Road to EpiAct promotes a great example of this. It includes areas where we should engage with governments and partner organisations to agree upon work towards achieving regionally relevant and realistic targets, that we should be developing national plans and investment of epilepsy services to prevent practices for prevention of practices and research, to collect information and core data for health services, planning and research, and to address access to treatment, including public awareness, medication availability, and increased reach. And we need to build integrated, people-centred and evidence-based care pathways and service models. To expand nationwide training and education at all levels, from community healthcare to primary and specialist care. So where would my epilepsy journey fit into this? Well, my immediate working environment, we provide care across primary to quaternary levels for epilepsy needs, with the promotion of improved diagnostics, both heavily at the clinical level, but also through the training and guidance on the correct use of tools such as EEGs, through the support of training non-specialists in the field, focusing on safe practice and recognition of management changing abnormalities. Also promoting the capacity to deliver specialist care within the African setting, with access to epilepsy surgery, epilepsy genetics, and targeted therapies such as the ketogenic diet. And specialist skills are truly deficit within the continent, so this is being targeted by running a training program to train doctors from Africa within the African setting, so that they return equipped with the necessary skills to continue working and developing services in their home African country. This is via the African Pediatric Fellowship Programme, and similar programs have been developed in the adult sector. Initiatives are constantly ongoing to expand the National Essential Drug List and to ensure anti-seizure medication availability happens across the country. Across Africa, a network of faculty has been established to provide training on focused courses called the Pediatric Epilepsy Training Courses. This was originally devised by the British Paediatric Neurology Association, and they are now well embedded in training practices, reaching clinicians at the entry point of people with epilepsy and empowering these healthcare practitioners with a standard language and management approach for epilepsy. The course has been so successful that it has been translated into Spanish and Portuguese and will imminently be rolled out in French. And along these lines, the course is being adapted for adult epilepsy content and will be rolled out soon. There are numerous superb initiatives across Africa promoting task shifting, typically skilling up community healthcare workers and nurses with the ability to diagnose and initiate care pathways for people with epilepsy, and avoiding delay in accessing care. The African Commission of the International League Against Epilepsy has supported and will continue to support these programs through various mechanisms, from direct funding to promotion of the projects. So, for International Epilepsy Day, this is my message from Africa. I look forward to hearing more messages from colleagues around the world.